And a very good afternoon, everyone. Welcome to Issues and Attitudes. My name is Jeff Owens, Director at WEIU. My co-host is Cade Slaughter. Welcome, Cade.
Thank you, Jeff.
And our guest today, Breana Johnson. She is Director of Nursing Excellence at Sarah Bush Lincoln. And Colleen Swick, Vice President for Patient Care Continuum at Sarah Bush. So welcome.
Thank you.
Thank you.
So I guess we'll just let you both start by giving them like a little bit introduction to your titles and your roles and maybe a little bit of background of what you each do. We'll start with you, Breana.
Okay, perfect. Yeah, thank you for having us. My name is Breana Johnson, and like you said, I'm the Director of Nursing Excellence at Sarah Bush Lincoln, and I oversee the Magnet Program designation for our organization, which is really exciting since we just got that here in August. So it's nice to be here.
And I'm Colleen Swick. I'm the Vice President of Patient Care and the Chief Nursing Officer. I've been with the organization since 1997 in a variety of roles, but in the role I'm currently in, I have oversight over all of the inpatient areas, the emergency department, and some of our outpatient post-acute care areas like home health and hospice.
It seems like every time people go out to Sarah Bush, the campus just continues to grow. So can you talk about explain some of the new space stuff at Sarah Bush Lincoln's new hospital for hospitalized patients, intensive care and all that stuff?
Sure, I'd be happy to. So last year, we opened an expanded intensive care unit and a progressive care unit, which is otherwise known as a step-down unit. And we increased our ICU from 9 beds to 14 beds, so increased our capacity significantly, and our PCU from 11 beds to 15 beds. And that gives us additional space to keep higher acuity, sicker patients because we've been able to increase some of the offerings that we have with different specialists at the hospital over the last several years. So it's really exciting.
Okay.
I was curious, can you discuss any innovative practices or technologies that have been implemented to enhance patient care? And also, I've been curious about AI, if AI has been used in the hospitals recently.
Sure, great questions. So we have recently started dialysis, which isn't innovative, but it is new for us to be able to offer in this area. Mm-hmm. Historically, we've not had nephrology coverage or nephrologists, and we've partnered with a group that's allowed us to do that so we can keep more patients in. We also have intensivists, which is great because now we have 3 that help provide coverage 7 days a week consistently, which allows us to keep sicker patients there as well. They're also pulmonologists, so they can manage a variety of diseases, which is awesome. As far as AI goes, we have some AI that's embedded in different systems that we use, our radiology system and some others, and we continue to evaluate. There's some really exciting offerings out there now, including ones that can even go so far as do transcription for doctors for their physician notes. It actually just can a recorder that can sit in the room and automatically create the note for the provider. So those are all things that we're looking into. We always have to be sure to check security from an IT perspective, but lots of really exciting things out in the market right now.
And Breana, with the magnet designations, for someone who doesn't know what that means, can you kind of go through that and the process of being designated a magnet, hospital?
Yeah, absolutely. So I kind of want to start out with the history of where Magnet came from and where it was created. And it was really back in the 1980s when our country was experiencing a nursing shortage, and the American Academy of Nursing actually created a task force. And that task force was responsible for going out and seeing what these successful hospitals were doing to attract and attain high qualifying nurses, and how they worked with interprofessional team members, and so what they were doing. And really the characteristics that task force found that set those hospitals apart from the others are what created the forces of magnetism. And so some of those things are things like autonomy, interprofessional teamwork, quality improvement, and organizational structure, along with many other things. And so it was in the 1990s then when ANCC, the American Nurses Credentialing Center, was incorporated to designate hospitals as a magnet organization.
And so then the process to become a magnet organization is not something that's overnight. It was like an 8-year journey from what I read in the press release and online. So talk about how Sarah Bush kind of went from the preparation of that to get to where you were this year.
Yeah, so we do call it a magnet journey because it does take multiple years to get that process put into place. So there's structures, processes, quality initiatives, improvements, and there's a wide variety of data that we have to use and report. Magnet, they want 2 years or 8 quarters worth of data, and so it takes a long time to get that as well. Then there's the application time frame, and then the documentation time frame, which it takes 2 years to write your document and get that approved. And so it just takes quite a few years to hit those milestones to even be able to apply to get to a designation.
So when you knew that you were going to get that, the designation, what was the feeling like in the unit and around Sarah Bush?
Colleen can help me with that, but it was extremely overwhelming with excitement.
It was. So when we got the call, you get a call to schedule a call to announce your designation with your organization. And I asked Bree repeatedly, are you sure? Like, we're not going to invite a lot of people and this isn't going to happen, right? But the room was absolutely packed. We had board members and multiple employees, and it was a great experience. And the level of energy was just crazy.
We're seeing some of that if you
Yeah.
have
Yeah,
catch
that's
this
crazy.
on
Wow.
one of our
Yeah.
TV places. But yeah,
Yeah.
it's really neat. I guess this might be a question. I don't know if you know, but is this the top level, or is there something past or is this like the peak for this?
So this is one of the highest achievements that a healthcare organization can receive. Now, recently, with the newest magnet manual that they've come out with, which is what we will write to this next designation, they have magnet with distinction.
Oh.
And so there's not any magical answer to that. It's what the commission decides with what you submit with your documentation, whether or not you meet distinction. So that is our next goal.
There you go. And I'm sure you're gonna
We
try,
will.
right?
Yeah, we're going to get it.
So can you discuss any community outreach programs the hospital's involved in?
Oh, sure. You know, we have lots of longstanding programs, including our mobile mammography van, as well as our children's dental van that go out. We provide a significant amount of dental services free of charge to patients, children who are unable to attain dental care. That's probably our most well-known community offering that we have. We're able to do restorative dental care for several children in our 10-county plus service area, which has been incredibly impactful. And then we're always looking at opportunities. We have our healthy communities where they have the fun little van that goes out and works with different school programs on healthcare and healthy communities, and increases step counts for kids in a variety of schools. So lots of things that happen to help us be more embedded in the community, and also to help improve the health of the community as a whole.
When you open up more rooms and more units, what can families and patients see from these updated units, and what can they expect in their care?
Sure. So I think the first thing that we always hear from people is just how pretty the physical plant is. You know, you can go to a lot of different facilities, and it's something that's expensive to maintain and upgrade as you go through. So just the size of the space, that was one of the biggest differences with our newest ICU, is the rooms are probably close to double the amount of square footage that we had historically, so the space for the family to be able to be present with the patient. And then the upgraded waiting rooms that come along with that, and you can just see the technology when you walk in. You know, everything is right there at the bedside, makes it very easy for us to monitor patients both remotely and on site, and I think those things are all very comforting to families when they come in.
I agree. Breana, this might be for you. You know, when you think about right now across the country, there is a nursing shortage. So how are you both, but really working on how to solve that for if not for Lakeland, for Sarah Bush, and then for the area, really, in terms of that nursing shortage?
I would say one thing that at least aligns with the magnet culture and the culture of excellence, we do have professional nursing governance, which is not just nursing, but it's where we have councils within our inpatient and ambulatory areas, and we have nursing along with other interprofessional staff on those councils. So they have a voice at the bedside. It helps attract and retain those staff. Not all hospitals have those nursing governance bodies. And so as a magnet organization, that's something that's unique to us, and I think it does help our nurses stay on task.
Is there like a recruiting plan that you implement to try to go out and find the best nurses that are graduating from local area places?
So we do. We have, obviously, all of the local area students do clinical rotations at our hospital, and so that is a great opportunity for our directors to start to develop relationships and for them to get to work side by side with our existing nursing staff and determine or be able to see how excellent the care delivery is and see that it's someplace that they really want to go whenever they're finished with school. And then we also have set up different scholarship opportunities in partnership with EIU as well as Lakeland to help to continue to attract and retain people who are local to the area so that after they finish school, we are their employer of choice.
What is the timeline, Kay, what is a timeline for someone who graduates high school that they could be working at Sarah Bush in terms of their college, how long it takes to get through college to get to be prepared.
Sure. It all depends on what program they go in. But for example, if you use Lakeland as an example, it's a 2-year program for an associate's degree, which then gives them the opportunity, in all honesty, they can start working as a patient care tech, which is similar to a CNA role at the hospital after their first semester of school without taking any additional certification. So they get some additional hand-on experience and really get comfortable in that environment as they complete their schooling.
Okay.
So what are the biggest communication challenges that you typically face in your roles, and just how do you address them?
Oh, I think one of the biggest challenges probably now is we have a lot of people who are either PRN or part-time or who also travel from further away, and having access to work email and different forums is just not probably as easily attained as what it used to be. A lot of people don't even have computers anymore at home. They're reliant completely on phones or iPads or something along those lines. So we have to get really creative in using different mechanisms. We have lots of private groups that directors use to communicate out to employees. And we as an organization, we try to make a lot of things available either via our internet or intranet, our internal communication platforms, so that we can get the same information. We do a lot of daily charges every day, so we're sharing the same information with everybody simultaneously, just to try and open up all of those pathways. We do town hall meetings, kind of come at it from a variety of directions to keep that messaging consistent.
Breana, I'm going to go back to the magnet designation again. Now, did somebody from the organization come and do a site visit at Sarah Bush to kind of, and how was that? I mean, that'd be a little nerve-wracking, I would think.
Yeah, and actually, I'm going to backtrack just a little bit on that. In order to get to site visit, we had to submit a documentation and get that approved. And so a little bit about what went into that documentation was we have to basically describe, demonstrate, give examples, proof, and evidence of how we met certain standards. And so with those standards, we had about 82 different stories that went into our documentation. And the commission then approved our documentation, and we actually went to site visit with no deficiencies. And so what that means is that our documentation and evidence was exceptional. They had no worries with what we submitted. And so our analyst actually told us that that's very rare for a first-time organization to go to site visit with no deficiencies. And she actually said we're among the elite because of that.
Wow.
So that was a very proud moment for all of us. And so the site visit, when we did get to site visit, that was in June, and it was virtual. It was for 3 days. We had 3 appraisers, and really the whole point of having the site visit is so that they can verify what we wrote in our document can come to life, big picture, and they can see that through the culture of our employees and our staff, our providers. And so it was for 3 days, and we had about 38 different meetings with the appraisers. So that was a lot. And then 32 different ambulatory and inpatient visits, and we used iPads to get from point A to point B so that they could speak with all of the staff members.
What about the patients? Do the patients have input into some of this, or is that part of the data part?
That would be just part of the data part. Because of confidentiality and HIPAA, we did not have patients involved.
Okay, that's fair. Katie?
I was going to say, how do you balance administrative duties with maintaining a presence in patient care areas?
That is a challenge, for sure.
She does a good job of that.
I try to do as much rounding as my schedule allows, and try to carve out specific parts of time as much as possible to where I can go out and about. And I try to be very approachable. Again, I've worked there for a long time, so even in my previous roles, there were a lot of people who are very familiar and feel comfortable or have worked with me or for me at different points in time. So I think that visibility, and they know that they have access to me at any given point in time. And I always reiterate, too, if I'm not there and you want to talk to me, all you have to do is send me a message. Most people have my cell phone number now, in addition to my email, so I'll get random texts that say, hey, I need to talk. And that's something that's very easy for me to step away and make time for.
As we head into the fall and winter season, cold season, what do you expect for the winter this year? High numbers, or any thoughts on this? I know COVID's kind of reared its ugly head a little bit there.
Yeah, we have, even in other times outside of the winter, our census has stayed high and continued to increase over the last several years. Just by nature, I think, of expanding our footprint into the community, adding different services and additional providers. We've doubled our medical staff really in the last 10 years. So we've seen a higher census than what we historically had, even year round these days. But it will pick up, obviously. We'll get into cold and flu season, and we'll get into COVID, and we'll have just sicker patients that present. We've gotten really good even with the additional beds at finding additional spaces to put people, because those beds last winter were not enough, even though we had those 21 additional that opened up right in November. We still find ourselves sometimes taxed with 10 plus additional patients that we don't have designated areas for. But we have lots of great flex space that we can use throughout the organization, and we're constantly looking at what's the next step as we continue to increase our patient population, how we can accommodate everyone.
Okay.
So I think you briefly mentioned it. Is COVID still really like a big issue, especially with all the different strains of it still, or is it kind of getting weak enough to the point where I don't really understand COVID necessarily too much, but is it like weak enough to where it's not really a problem anymore? Is it still affecting the hospital numbers there?
It is, but not significantly. So it is something that we monitor daily. We monitor this time of year how many COVID patients we have admitted, how many influenza patients we have, and how many RSV patients we have. COVID numbers have been below 10 for the last several weeks. We'll see some spikes in that, but really it's nowhere near like it was in the heat of the pandemic, where we were having 20 or 30 patients who were really, really sick in. Yeah.
It seems in every facet of life, technology just changes and evolves, and it may get better, it may get worse, depends how you look at it. But how do you stay on top of that at Sarah Bush, and then also immediately get that down to all the nurses so everybody knows what they're doing? Can you take us through some of the technology processes?
Sure. So it always starts with our information technology department, who are phenomenal. They always have to evaluate safety first. I think everybody's probably heard about some of the protected health information breaches that some other organizations have experienced, and that's something that we always have to be really cautious and always 2 steps ahead of. And then when we identify a technology like our charting systems, or right now, for example, we're getting ready to replace our existing messaging system that we use between physicians and providers and nursing staff. And so there'll be a multidisciplinary team that comes together with IT to vet all of it, test it, build it out, and then it will be educated down to all of the nursing staff or other disciplines that will be using it. But I feel like it's one thing after the other, and IT would agree with me on that. We get one thing implemented, and there's already 6 more things waiting to go next. And so sometimes it's difficult to determine whose burning platform is the most important burning platform. And
that's a busy department.
Yeah, there's a little bit of competition there, and we have to step back and decide what has the biggest impact, what's the most important thing to do. But there's always a later and greater version of everything that's coming out. So it's not just new systems, it's upgrading existing systems, and it all takes a lot of time and training. Our home health and hospice are both getting ready to go live with an upgraded version of their documentation system, and it's been, we kicked that off in January. So, it's just a tremendous amount of time and energy goes into all the prep work and then training of all the frontline staff as well.
Did you want to add anything to that, Breana?
No, she hit it right on.
Go ahead, Katie.
So as far as intercultural communication goes, I know there can be language barriers, of course, with patients. How do you handle that necessarily, or do you have enough people employed to really handle any possible alleged language barriers that can pop up?
So, we used to use translators, and that was really easy when there was maybe one language that you would see, and historically it was always Spanish was the most prevalent. But what we identified several years ago was that the amount of languages that we were seeing far exceeded any ability to have translation, in-person translation services. And so we partnered with a service called Language Line, and it's available on iPads and phones, and they have almost every single language you could ever identify as being needed. Recently we've seen a large increase in Haitian Creole, the need for Haitian Creole interpretive services. And so that is something that they have available, and we use that as an intermediary to where you're basically on speakerphone or FaceTime, and the patient and the clinician and the interpreter are all communicating together simultaneously through that. We have that available in all of our outlying physician clinics as well as in the main hospital campus, because we try to use that as opposed to using family members, even though sometimes patients want to do that we don't don't know what the translation
Yeah.
that they're providing is. Whereas on the language line, there are people who have been trained in medical technology or terminology, so we know that the translation is going to be 100% what we need it to be.
And we also have the inclusion team that looks at some of those areas too, and they have helped with integrating new things for our patients as well.
Well, when you think even like Eastern Illinois, the last few years, the international students here have
Mm-hmm.
risen dramatically. So, some of them
yeah.
are going to have to need Sarah Bush or another hospital for sure. What's the best part about your jobs? I mean, I'll let Breana start. What's the best part?
I would say the best part of my job is getting to work with so many different team members and professions within the organization, because Magnet is very big picture. So it's not just nursing; it's working with lab, radiology, pharmacy, performance excellence, patient experience, like our culture of excellence teams too. So there's a lot of teamwork, quality teams. I would say just the variety of people, and then getting up on the units to do some rounding with our nursing staff with the inpatient and ambulatory areas.
Yeah, mine's probably along the same lines. I've been there for a long time and had the opportunity to work with a lot of people in a lot of different areas. I loved seeing the growth that we've experienced. When I started there, it was a concrete rectangle in the middle of a very, we still had cornfields in front of the hospital between us and Route 16 whenever I started. So it's just incredible for me to be able to operate on the executive team and be able to see and help plan for all of that continued growth and how we can continue to provide all of the services for the community.
Was Sarah Bush your first job? I mean, because you said you've been there 27 years.
So I worked for a very brief period of time at a nursing home when I started my bachelor's degree. I went through an associate's degree program similar to Lakeland, and for 6 months I did I started my bachelor's degree over in Edwardsville, but then it was my first hospital nursing job. So yeah, I've had the opportunity really to grow my entire career and it's just incredible what we can do with patient care now compared to what we could do then is just mind blowing.
And your journey was a little bit different. You're a local, and you ended up with a couple of spots before coming back to the area.
So I worked locally, but also my career path in life has taken me to Pennsylvania. I lived there. I've lived in Iowa and then moved back to the Effingham area, which I'm originally from that area. And I've worked at Sarah Bush the last 4 years. And so my background in nursing is actually all surgical related. And so it's kind of fun to get to see this side of what nursing can offer too.
We're talking to Breana Johnson and Colleen Swick today from Sarah Bush Lincoln about some of the new things going on out there. We have about 6 minutes left. What I think Kate touched on a little bit, but what is like everything we talked about today is good, but there's also got to be tough days. Can you tell us about a tough day or the toughest part of your job or even a challenge?
I think the toughest part, sometimes is juggling everything, figuring out what you have to prioritize and what you have to get done. In my nursing career, my bedside nursing was in critical care, so my threshold sometimes sounds a little bit crazy for some people because my question is usually, is everybody alive that's supposed to be alive? Because if it's not, it's all recoverable at that point in time. And even the hard days, you've got to, that the next day is going to be good and we're doing good things. It's just trying to balance everything can sometimes be a real challenge.
Yeah, and I would say I would agree with her. And then balancing the day-to-days with the project work, I'm always trying to meet those timelines. And then obviously making sure our patients are being well cared for. But always looking at future state too. Colleen does a really good job with that, making sure we're headed in the right direction with her leadership. And so I think just making sure that we're staying on track with, where we need to lead our organization it's tasking, I would say. I mean, it takes a lot of effort to get where we need to be.
Okay.
So what are your future goals or visions for nursing excellence at Sarah Bush Lincoln Hospital, or just any goals in general for the hospital?
So as far as Magnet, with our designation currently, for the next 4 years, we're in an interim monitoring stage. And so it's really exciting. ANCC has come out with the newest manual. So we have the 2023 Magnet manual to write to. And again, so a big goal for me is Magnet with distinction in 2029, I think, is when we'll be coming up on that. So we'll be submitting our next document August of 2028 with site visit in 2029.
Okay.
Yeah. And I'm always focused on recruitment and retention of nursing staff and really providing an incredible environment for patients to receive care, but also for nurses to deliver care. It's not an easy job. It's gotten much harder through the years, with changing, I think, just the way that all of us have changed in our in the outside world over the last several years. And so I want to make it a place where people want to come and work, where they love to work there, and would like to see a return to that, not just just staying at a job for a year or two, but people who want to stay for the entirety of their career because it is an amazing place to work.
What are the main needs at Sarah Bush in terms of jobs? Is it nurses, or are there other areas out there that you're looking for right now in terms of open jobs?
There's other areas as well. You know, we're always looking for support staff as far as environmental services and our dietary services. Nursing is one that we continue to try and recover from a recruitment standpoint, as everybody has. You know, Bree referenced the nursing shortage, which I feel like has been an ongoing, predating me in 1997 at different levels through the years. But, you know, there's always opportunities. We are the largest employer in downstate Illinois, and so again, really excited for people to get back into the workforce who maybe have been out of it for a while. We have great benefits, great opportunities. I would encourage anybody to take a look at our job board.
And speaking of, you talked about leadership, Breana. Kim Uphoff was recently named the chief administrator out there. So can you talk a little bit about Kim? I know she won't like this, but we need to, right?
No, Kim, she's amazing. I really enjoy getting to talk with her when I do, and then at management team when she presents. She has just a high level of professionalism. She knows her job well. She has a lot of people at the organization, staff members that really respect her, and she does a great job leading us and all of the vice presidents at the organization as well.
Mm-hmm. Yeah, she's so engaged in the community. You know, she's local, born and bred, and she's been there as long as I have. And so it's amazing to get to work with somebody directly who has the same vision and enthusiasm for the organization that I do.
And I think with a couple minutes left, we would be remiss if we didn't mention that there is a loss at Sarah Bush. Patty Peterson retired.
Yes.
Patty was the marketing director and everything in PR out there. And her last day was Friday, you said?
Yes,
So
yeah.
what's that going to mean at Sarah Bush without Patty there?
Well, you know, there was a running joke that whenever her new replacement was interviewed and was asked, what would, you know, how will you handle difficult situations? She said, I'll ask myself, what would Patty do or say? And I think that's what a lot of us think. You know, Patty has been a constant to where if I'm uncertain of how to approach something, she was somebody that I would call and say, what do you think? How do you think this would play if I say it like this? And, you know, she's just accomplished so many incredible things as far as growing us as an organization and putting it out there. Won several awards. It will definitely be felt. Her presence will be missed, but I'm hopeful that she will continue to be very visible, and we have great bench strength in that department to carry us forward. But yeah, she's been incredible.
Anything you want to add, Breana?
Yeah, I've actually got to know Patty quite a bit better these last few months since our site visit with Magnet. I've worked a lot with her with just news releases or press releases, the vital signs, our newsletters, and so she just has a really great way with words. She knows exactly what to say. She knows how to tweak it to make sure that we're saying the right thing. And so I will definitely miss her, but I know she's being replaced by another great employee as well.
There you go. We're about out of time, so we'll do a couple rapid fire questions. What's the best food you will eat in the cafeteria out there?
Oh, that's a tough one.
I like the party potatoes. They're like mashed potatoes. They're one of my favorites.
Ranch chicken is
Oh,
probably
yeah,
that
one
sounds
of
good.
my favorites. Yeah.
In general, a food you will not eat no matter where you're at.
Ooh.
Peas.
Oh,
Mine's probably lima beans along that same.
I love both of those.
Oh,
Come on.
sorry.
Yeah.
Medical-related movie or TV show you can't miss?
Ooh, you know what? I can't watch any of them because all I can do is criticize
Yeah,
all
I
the
was
things
gonna
they
say.
do wrong.
Same.
Really good.
Especially Grey's Anatomy when they have a surgical procedure and they don't have the right sterile technique.
Yeah.
Well, thank you so much for coming in. It was a great show. We'll talk to you guys soon.
Thank you.
Thank you.
We are WEIU.